Hi, my name is John Bang. I'm a student pharmacist at the University of Minnesota. Today I'm going to explain to you how to use a self-monitored blood glucose meter. Uh, the first thing you want to do is you want to take out your glucometer, your test strips, your lancet needles, alcohol wipes if you have any, band-aids as well if you need it. Um, First thing you want to do is you want to check your test strips for the expiration. Most test strips will expire 4 to 6 months after opening, so you need to be aware of that. Um, Secondly, you want to turn on your meter. You want to check the date and time to make sure it's correct. If this is the first time you're using your glucometer, then you're going to have to run a few tests with the control solution. We'll dive deeper into that in a little bit, but I'll just explain to you how you should do it first. So you also want to use your lancet to extract the blood, or not extract the blood, but to draw some blood from your finger. That's very simple. Once you put the needle in, it's pretty much a click. Push down all the way, and the little needle will poke you, and then that's how you're going to draw your blood. The first thing you're going to want to do after having all your supplies out is you want to wash your hands with warm water and soap. Wash your hands very thoroughly. The warm water will help your blood flow a little bit better. And then after you're done washing your hands, dry them very well. You want to load the lancet. So you want to take your lancet, you want to take your cap off, or your lancet tool, take your cap off, place the lancet needle in, take the cap off of that, and then put your lancet tool cap back on. And then once that's done, put it off to the side. You want to take your test kit, or your test strips, grab a new test strip in, be very careful not to touch the center of it. Place it into your glucometer, and it will turn on. Most of them will turn on. If not, turn on your glucometer and then push it in. And then close your test strips. You're going to want to set that down, and then you're going to want to draw some blood from your finger. The easiest way to know where to do it is to put your hands together like this, and you're going to want to do it on the side of your finger, and preferably your middle finger or ring finger works best usually. You don't want to do it on the center, on the pad, because that's a lot more painful because you have more nerves, but on the side of the finger is good. So what you're going to do is you're going to put the lancet on your finger, the side of your finger, and then you're going to want to make sure it's all the way on, and then you just click all the way through, and then that's going to draw blood, and then you're going to want to just slowly massage it. Don't actually squeeze hard or anything, just kind of massage it and draw a blood droplet. You're going to want to do that until you have a drop about the size of a ladybug. You'll take your glucometer with your strip in it, and you're going to want to just have the end of the strip touch the droplet. Don't actually touch your skin, but just touch the droplet. Once that's in, the glucometer will run the test. You're going to want to wait until your test is done and get your results before you throw anything away or wipe anything off. That way you don't have to repoke yourself and everything. Once your test results are in and they are as expected, you can wipe your finger and apply your band-aid. You'll want to dispose of your lancet needle into a sharps container, or if you don't have one at home, like a metal coffee can, something like that would work as well. Once you discard that, your used test strip can go in the trash. If you need to, you can wipe your meter down with an alcohol wipe. And then you want to store all of your supplies in a cool, dry, safe place, away from kids and pets. Once you're done with that, before you store it though, you're gonna want to write down your results in a blood glucose diary. You also want to record the date, the time, were you fasting, exercise, after food. You want to record all of that so that you can start building up a history of blood glucose levels. And then that way you will have a history of it, and you can compare to see if your numbers are accurate. The next thing is we just want to go over, again, making sure that all your equipment is clean, making sure your test strips are not expired, they're not exposed to anything, they're still functioning. You also will want to learn how to test your glucometer, and that's very simple. All you do is you put a new test strip into your glucometer, and then you put some control solution on there, and then you just check your results of the control solution with what is given to you as a reference through the test strips. And once you do that, we recommend you running the control solution 3 times on 3 test strips, 3 new test strips, to make sure you have a properly working machine. And then we also want you to know how to replace your batteries in your glucometer. It's very simple. It's just on the back. So yeah, once you know how to do that too, then you should be good. We also recommend you visiting your doctor on a regular basis, always bringing in your blood glucose diary with you so that your doctor can go over it. Yeah, so that's it. Do you have any questions for me? Okay, thank you for stopping by. Please feel free to contact us if you have any other questions. Thank you.